Most seniors believe clogged arteries happen suddenly, but in reality the process begins quietly, years before symptoms ever appear in daily life. Many people over 60 are shocked when scans reveal narrowed arteries despite normal cholesterol levels and years of following standard medical advice. Cold feet, heavy legs, morning weakness, or dizziness are often dismissed as aging, yet they are early warnings of circulation breakdown. What most seniors are never told is that arteries do not clog simply because of fat or age alone. They clog because the biological signals that keep blood vessels open slowly disappear after 60. Doctors often focus on lowering cholesterol numbers, but this does not restore the inner function of aging arteries. You can have good lab results while blood flow to your legs, brain, and heart continues to worsen silently. The real danger is not a sudden blockage, but years of reduced circulation, starving tissues of oxygen. This is why many seniors feel weaker each year despite walking daily and taking prescribed medications. Here's the surprising truth. One specific vitamin directly controls how wide or narrow your arteries stay. After 60, levels of this vitamin collapse in most people without obvious symptoms. When it drops, nitric oxide production falls, arteries stiffen, and blood flow slows dramatically. This is not speculation, but a process documented in decades of cardiovascular research. Even more surprising, most seniors who take this vitamin still use it the wrong way. Wrong timing, wrong combinations, and misunderstanding its role cancel out its benefits completely. This explains why some people see no improvement, while others feel warmer legs and stronger walking within weeks. Today, I will show you which vitamin truly helps restore artery function after 60. I will also explain why it works, how to use it safely, and who must be cautious. Before we begin, comment below and tell me your age and where you are watching from today. And ask yourself this honestly. Do your legs feel as strong and warm as they did 10 years ago? Viet Cao Chuyen Tu Mo Bai Vao Part 1. What unclogging arteries really means after 60. To understand why this vitamin matters so much, we first need to clear up a dangerous misunderstanding about what unclogging arteries actually means after 60. What unclogging arteries really means after 60. Most seniors imagine clogged arteries like pipes filled with grease, but the reality inside aging blood vessels is far more complex and misunderstood. Arteries rarely become blocked overnight. Instead, their inner lining slowly loses flexibility and responsiveness over many years after 60. This process begins with endothelial dysfunction, where the artery's protective inner layer stops releasing signals that keep blood flowing smoothly. When this lining weakens, arteries cannot relax properly, even if cholesterol levels appear normal on standard blood tests. Unclogging arteries does not mean scraping out plaque, but restoring the vessel's ability to widen and respond to blood flow demands. After 60, arteries become stiffer, narrower, and less adaptive, reducing circulation long before severe blockages ever form. This stiffness limits oxygen delivery to muscles, nerves, and organs, creating symptoms without dramatic imaging findings. Many seniors feel heavy legs, cold feet, or brain fog because blood flow becomes inefficient, not because arteries are fully blocked. Traditional treatments often focus on lowering cholesterol numbers rather than improving arterial function itself. Lower numbers may reduce risk, but they do not automatically restore healthy vessel behavior in aging bodies. True circulation depends on nitric oxide, a molecule that signals arteries to relax and open when blood demand increases. After 60, nitric oxide production declines sharply, causing arteries to remain partially constricted throughout the day. This constant low-grade constriction creates chronic circulation stress, even without obvious pain or warning signs. Unclogging arteries therefore means reactivating the biological signals that allow vessels to open naturally. When arteries regain flexibility, blood moves more freely, reducing strain on the heart and improving tissue oxygenation. This improvement can occur even without dramatic changes in plaque size or cholesterol measurements. That is why some seniors feel better before scans show measurable structural changes. The goal after 60 is functional restoration, not chasing perfect numbers on lab reports. Understanding this distinction explains why many treatments disappoint while others produce noticeable improvements. Once you see unclogging as restoring function, the role of the right vitamin becomes much clearer. Now that we understand unclogging arteries means restoring function rather than removing plaque, we can uncover the real root problem driving circulation decline after 60. The real root cause: nitric oxide collapse after 60. Nitric oxide is the key molecule that tells your arteries when to relax, widen, and allow blood to flow smoothly to every tissue. In younger adults, nitric oxide is produced constantly, adjusting circulation moment by moment based on movement, stress, and oxygen demand. After 60, this production drops dramatically, often by 50 to 70%, according to multiple cardiovascular aging studies. This decline happens quietly, without pain, making it easy to miss until circulation problems become noticeable in daily life. Nitric oxide is produced by the endothelium, the delicate inner lining of blood vessels that deteriorates with age. As this lining ages, it loses the ability to respond properly to blood flow and chemical signals. Without enough nitric oxide, arteries remain partially constricted even when the body needs more blood. This constant constriction increases resistance, slows circulation, and forces the heart to work harder unnecessarily. Reduced nitric oxide also promotes inflammation inside vessels, accelerating stiffness and functional narrowing over time. Blood becomes less able to flow efficiently to the legs, brain, kidneys, and peripheral nerves. This explains why seniors often experience cold extremities, heaviness, dizziness, or mental fog without obvious blockages. Many treatments lower cholesterol or blood pressure but do nothing to restore nitric oxide production itself. As a result, numbers may improve while symptoms quietly continue or even worsen. Nitric oxide collapse also increases the risk of microclots forming in small vessels. These tiny clots further impair circulation, but rarely appear on standard scans. Over time, this combination creates chronic oxygen deprivation at the tissue level. Muscles weaken faster, nerves become more sensitive, and balance deteriorates gradually. This process is not inevitable, but it is strongly linked to nutritional and biological changes after 60. Restoring nitric oxide signaling is therefore central to truly improving circulation in seniors. And this is where one specific vitamin plays a surprisingly powerful role. With nitric oxide loss as the real driver of circulation decline, it becomes clear why many popular heart supplements fail to deliver meaningful results for seniors. Many seniors take heart supplements expecting better circulation, yet months later notice little change in strength, warmth, or walking ability. The primary reason is that most supplements target cholesterol or inflammation, but ignore nitric oxide production entirely. Omega-3, garlic, turmeric, and CoQ10 offer benefits, but they do not directly restore endothelial signaling after 60. Without addressing nitric oxide collapse, these supplements cannot reopen stiff, aging blood vessels effectively. Another problem is absorption, which declines significantly with age due to digestive changes and medication interactions. Seniors often swallow high doses that never reach the bloodstream in meaningful amounts. Timing also matters, yet most people take supplements randomly, reducing their physiological impact. Many heart formulas combine dozens of ingredients in tiny amounts that fail to reach therapeutic thresholds. This creates the illusion of comprehensive support without delivering real biological change. Some supplements focus on short-term blood thinning rather than long-term vessel function restoration. Temporary effects may feel reassuring, but they do not improve daily circulation reliability. Others rely on antioxidant claims that do not translate into improved blood flow in aging arteries. Marketing often exaggerates benefits while ignoring age-specific biology. Another issue is that seniors expect supplements to compensate for poor vascular signaling caused by nutrient deficiencies. Without restoring foundational signals, supplements merely support the surface, not the source. Many seniors also discontinue supplements too early, expecting rapid results that circulation improvements cannot provide. True vascular recovery happens gradually as endothelial function improves. This requires precise support rather than generic mixtures. Understanding these failures helps explain why one targeted vitamin outperforms dozens of popular supplements. And that brings us to the single nutrient proven to restore arterial signaling after 60. Once you understand why most supplements fail, the focus naturally shifts to the one vitamin shown to directly restore arterial function, rather than simply mask symptoms. Vitamin D stands apart because it directly regulates endothelial health, nitric oxide production, and arterial flexibility, rather than targeting cholesterol numbers alone in aging bodies. After 60, vitamin D behaves like a hormone, binding receptors in blood vessels and activating enzymes that restore proper vessel relaxation over time with consistency. Research shows low vitamin D levels strongly correlate with arterial stiffness, reduced flow-mediated dilation, and higher cardiovascular risk in older adults across multiple populations worldwide. When vitamin D is deficient, endothelial cells struggle to produce nitric oxide, leaving arteries partially constricted throughout the day in many seniors after 60 years. Supplementing vitamin D has been shown to improve vascular responsiveness, reduce inflammation, and enhance blood flow without aggressive pharmaceutical intervention in aging populations studied extensively. Unlike many heart supplements, vitamin D targets the root biological pathway responsible for stiff, narrow arteries after 60 in older adults worldwide, consistently documented scientifically. Clinical trials demonstrate that correcting vitamin D deficiency improves arterial elasticity even when cholesterol levels remain unchanged in seniors monitored over months and years carefully. This explains why some seniors feel warmer limbs and easier walking before any imaging shows. Structural plaque reduction becomes visible on traditional cardiovascular diagnostic scans. Vitamin D also reduces vascular inflammation, protecting the endothelium from ongoing damage caused by aging, stress, and metabolic imbalance commonly seen in seniors today globally. By restoring endothelial signaling, vitamin D allows arteries to respond naturally to movement, posture changes, and oxygen demands during daily activities in older adults safely. This functional improvement lowers strain on the heart while improving circulation to the brain, legs, and vital organs throughout the aging body over time naturally. Vitamin D deficiency is extremely common after 60, even among seniors who eat well and take multiple supplements without correcting absorption, timing, or dosage strategy. Most importantly, vitamin D supports nitric oxide pathways without overstimulating the cardiovascular system or causing sudden pressure changes that increase fall risk in older adults. This makes vitamin D uniquely suited for seniors who need gentle, sustained improvements rather than aggressive interventions to preserve balance, safety, confidence, mobility, independence, longevity. However, effectiveness depends entirely on how vitamin D is used, including timing, dose, and supportive nutrients appropriate for age, digestion, medications, lifestyle, sun exposure, consistency. Taken incorrectly, vitamin D may show little benefit despite adequate dosing on paper according to standard recommendations that ignore senior biology, absorption, timing, context, needs. This misunderstanding explains why many seniors abandon vitamin D prematurely, assuming it simply does not work for aging arteries, circulation, balance, energy, strength, safety, longevity. When used correctly, vitamin D helps restore the biological environment arteries require to stay open and flexible throughout daily circulation, aging, repair, adaptation, resilience, function. This is why researchers increasingly describe vitamin D as a vascular regulator, not merely a bone vitamin in modern cardiovascular aging science literature worldwide today. Understanding this role sets the stage for learning how most seniors accidentally cancel vitamin D benefits through common mistakes, poor timing, absorption, interactions, habits, routines. Now that you see why vitamin D can restore artery function, the next critical step is understanding how common usage mistakes quietly cancel its benefits for most seniors. Many seniors take vitamin D faithfully, yet see little improvement because the problem is rarely the vitamin itself, but how it is used daily. The most common mistake is taking vitamin D at night, which can interfere with melatonin and quietly disrupt sleep quality after 60. Vitamin D acts like a hormone, meaning timing strongly influences how the body responds to it throughout the day. Taken too late, vitamin D may increase alertness when the nervous system should be winding down for rest. Another widespread error is swallowing vitamin D on an empty stomach, which drastically reduces absorption in older adults. Vitamin D is fat-soluble and requires dietary fat to enter the bloodstream efficiently. Many seniors avoid fats, unintentionally blocking vitamin D from reaching its target tissues. High doses taken inconsistently are another mistake that cancels benefits rather than enhancing them. The body responds better to steady, moderate intake than sporadic megadoses taken once or twice weekly. Some seniors chase higher IU numbers without understanding that blood levels matter more than dose size. Without magnesium, vitamin D activation inside cells becomes inefficient, limiting vascular and muscular benefits. Yet magnesium deficiency is extremely common after 60 and often overlooked completely. Another issue is combining vitamin D with medications that impair absorption without adjusting timing or dose. Acid blockers and certain cholesterol drugs can reduce how much vitamin D the body actually uses. Many seniors also assume sunlight alone is sufficient, despite aging skin producing far less vitamin D. Others stop supplementation too early, expecting rapid results when vascular repair requires weeks or months. Vitamin D does not work like a stimulant. It rebuilds signaling pathways gradually. Failure to monitor symptoms leads many seniors to abandon vitamin D before benefits appear. When used incorrectly, vitamin D looks ineffective even though the biology remains sound. Understanding these mistakes is essential before learning how to use vitamin D safely and effectively after 60. Once these common mistakes are clear, the focus naturally turns to how vitamin D should be used safely and correctly to truly support aging arteries. The safest way to use vitamin D after 60 is to treat it as a daily biological signal rather than a quick fix supplement. For most seniors, vitamin D works best when taken in the morning or early afternoon, aligning with natural circadian rhythms and vascular hormone activity. Taking vitamin D earlier supports nitric oxide production during the day when arteries must adapt to movement, posture changes, and oxygen demand. Vitamin D should always be taken with a meal containing healthy fat to ensure proper absorption into the bloodstream. Without dietary fat, much of the vitamin passes through unused, especially in older adults with reduced digestive efficiency. Consistency matters more than dose size, meaning a moderate daily intake outperforms large doses taken irregularly. Blood levels respond best to steady intake that avoids spikes and crashes in circulating vitamin D. Magnesium should be adequate when using vitamin D, because magnesium activates vitamin D inside cells where vascular benefits occur. Many seniors unknowingly block vitamin D benefits by remaining magnesium deficient. Spacing vitamin D away from certain medications may improve absorption and reduce interference with activation pathways. Seniors using acid blockers or cholesterol medications should be especially mindful of timing and consistency. Vitamin D should not be taken late at night, as it may disrupt sleep and indirectly worsen blood pressure regulation. Improved sleep quality often enhances vascular health, making proper timing even more important. Benefits usually appear gradually, including warmer extremities, steadier walking, and more stable energy. These changes reflect improved arterial signaling rather than dramatic shifts on lab reports. Vitamin D should support, not replace, prescribed cardiovascular treatments under medical supervision. Monitoring symptoms provides better feedback than chasing specific IU numbers alone. Seniors should reassess vitamin D use after several weeks rather than expecting immediate transformation. Used correctly, vitamin D creates a biological environment where arteries can relax and function more naturally. This approach prioritizes safety, stability, and long-term circulation support rather than aggressive intervention. With the right approach in place, the next step is understanding which seniors benefit the most from vitamin D support and which situations require extra caution and medical guidance. Seniors who benefit most from vitamin D support often notice cold legs, heavy walking, morning weakness, or unstable balance that worsens gradually over time. Those with limited sun exposure, darker skin, or living in northern climates are especially likely to have low vitamin D after 60. People with peripheral artery symptoms, diabetes, or metabolic syndrome often experience meaningful circulation improvements when vitamin D deficiency is corrected carefully. Seniors with fluctuating blood pressure may benefit because vitamin D supports vascular relaxation and steadier endothelial signaling throughout daily activities. Older adults experiencing frequent infections or slow recovery often respond well, since vitamin D also strengthens immune regulation alongside vascular benefits. Those taking acid-blocking medications or steroids are at higher risk for deficiency and may notice greater improvements when vitamin D is used correctly. Seniors with limited mobility or who rarely go outdoors often have the most dramatic baseline deficiencies to correct safely over time. However, not every senior should supplement aggressively without guidance, especially those with kidney disease or a history of kidney stones. High calcium levels or certain parathyroid conditions require careful monitoring when using vitamin D to avoid complications. Seniors already taking high-dose calcium should approach vitamin D thoughtfully to prevent imbalances that may affect arteries or kidneys. Those with sarcoidosis or rare granulomatous diseases can overproduce active vitamin D and need medical supervision. People using multiple medications should consider timing interactions that may alter absorption or metabolism of vitamin D significantly. Very high doses are rarely necessary and can increase risk without improving vascular outcomes after 60. The goal is restoring physiological balance, not forcing levels far beyond what the body can safely use. Seniors who feel dizzy, weak, or unwell after supplementation should pause and reassess with professional input. Vitamin D works best as part of a balanced approach including magnesium, nutrition, movement, and sleep. No supplement replaces medical care, especially for advanced cardiovascular disease or complex conditions. When used responsibly, vitamin D supports circulation without destabilizing blood pressure or increasing fall risk. Understanding personal risk factors allows seniors to benefit while avoiding preventable complications. This balanced perspective ensures vitamin D remains a supportive ally rather than a hidden risk after 60. Conclusion: unclogging arteries is not about age. Many seniors have been led to believe that clogged arteries are simply the unavoidable price of getting older, something that happens no matter what choices they make. But the truth is far more hopeful and far less frightening than that long-standing belief suggests. Arteries do not fail simply because birthdays pass. They fail because the biological signals that keep blood vessels flexible, responsive, and open quietly fade over time. After 60, the problem is rarely that arteries are suddenly filled with plaque overnight. The real issue is that blood vessels lose their ability to relax, widen, and adapt to changing demands. This loss of function slowly reduces circulation to the legs, brain, and vital organs, even when scans look acceptable. Many seniors live for years with worsening circulation while being told everything looks fine. What truly drives this decline is not age itself, but a combination of missing biological signals and foundational nutrient deficiencies. Nitric oxide production drops, endothelial cells weaken, and inflammation quietly stiffens arteries from the inside. When these signals disappear, arteries behave like rigid pipes instead of living adaptive tissue. Blood flow becomes inefficient, oxygen delivery declines, and symptoms appear gradually rather than dramatically. Vitamin D matters because it helps restore the internal environment arteries need to function properly. It does not scrape plaque away or replace medications when they are necessary. Instead, it supports the signaling pathways that allow blood vessels to relax naturally and respond to daily movement. This is why vitamin D can improve how arteries behave even when cholesterol numbers barely change. Understanding this distinction changes everything. You are not broken because you feel colder, weaker, or less steady than you once did. Your arteries are responding to years of reduced signaling support, not a sudden failure of will or discipline. When the right signals are restored, circulation can improve even after 60. Vitamin D is not a miracle cure, and it is not a replacement for medical care, but it plays a unique role in correcting the biological environment inside blood vessels. Used correctly, it supports nitric oxide production, reduces vascular inflammation, and helps arteries regain flexibility. This is why some seniors notice warmer legs, steadier walking, and more consistent energy over time. The goal after 60 is not chasing perfect numbers or fighting aging aggressively. The goal is supporting the systems that allow you to move confidently, think clearly, and live independently longer. Small, consistent actions often matter more than dramatic interventions. Restoring signals works better than forcing outcomes. If this message resonates with you, take a moment to reflect on your own circulation. Comment below and tell me your age and where you are watching from today. Share this video with someone you care about who is over 60 and may be struggling quietly. And subscribe to Dr. John Senior Health if you want clear, practical explanations that respect how the body truly changes with age. Remember this above all, we don't fight aging, we restore the signals that keep blood flowing.